Hello, my name is Savita Manvel and I'm a nurse by profession, 15 years into this profession, and currently I'm working as a nurse educator with a leading hospital in Mumbai. Today I'll be talking to you about bedsore, which is also known as pressure injury, pressure sores, pressure ulcers, decubitus ulcer. There are various terms. So as the word itself says, pressure injury. So it is mostly caused because of continuous pressure that is over a body part or a body area which is under pressure. It could be because of continuous lying in a particular position or continuously sitting in a particular position. So a person can develop the pressure injury. Now the reason why a person could be continuously lying on bed may be because of certain disease condition or the illness that they have. Maybe the patient is semi-conscious, patient is in comatose stage, or there is a limited mobility. Maybe the patient is a fracture patient wherein their mobility is being reduced or it is affected. So because of these conditions, they may be continuously on bed, and there could be pressure over the bony surfaces of their body, and then they could develop these bed sores, which is a common term that we know. There could be other causes or other conditions also wherein a patient can develop a bed sore or a pressure injury. So it could be, as we said, first is limited mobility, poor nutrition and hydration. If there is a poor nutrition or hydration, that affects the wound healing. The subcutaneous tissue is being lost. So because of that, there is a high possibility the patient can develop a pressure injury. Others could be like excessive weight loss or excessive weight gain. Again, if a person is very obese, there is a limitation in the mobility. So again, this can cause a pressure injury. Then lack of sensory perceptions. There are various disease conditions which is common is diabetes, wherein the patient, the blood circulation gets affected, and there could also be loss of sensation, because of which the person may be developing a pressure injury but they may not be aware because of the lack of sensation. There are other disease conditions like neuropathy, patient is unconscious, or any spinal cord injuries. Other causes or other conditions wherein a person can get a pressure injury could be an incontinence. It can be either a urinary incontinence or a fecal incontinence. So about the incontinence, we shall deal with it in detail in our further videos to come. Then also because of any past history of pressure injury. So these are certain conditions wherein a patient can develop a pressure injury.